Welcome to Don't Wait, Vaccinate, Your Questions Answered, a special WAGM-TV community conversation, a live one-hour program featuring county medical professionals addressing questions and concerns related to the COVID-19 vaccines submitted by you, our viewers. And now, here are your hosts, Kelly O'Mara and Jason Parent.
Well, good evening and welcome into our Don't Wait, Vaccinate question and answer session. I'm Kelly O'Mara and I'm joined by Jason Parent, the CEO of ACAP. We will just be helping along the conversation this evening, asking questions that many still have about the COVID-19 vaccine.
Indeed, Kelly, and we're pleased to be joined for that conversation by four medical providers from the county's four hospitals. To my far left, I'm pleased to welcome Jose Roman, who is a FNP at the Oncology Unit at Carey Medical Center. Next to her is Dr. Jordan Albert, who is the Pharmacy Manager at Northern Maine Medical Center. Immediately next to Kelly is Dr. Renee Fournier, a pediatrician at Northern Light A.R. Gould Hospital. And next to Dr. Fournier is Dr. Brian Griffin, the Chief Medical Officer and an Emergency Department provider at Houghton Regional Hospital.
That's right. Well, we're looking forward to our discussion with all four of you guys this evening. We're excited to have you. Our phone lines are also open with people ready and willing to take your questions, including Dr. Cameron Grange from Fish River Rural Health. You can call at 554-5153, and please feel free to call anytime during the next hour to get your questions answered.
And now we're going to look at some of the questions in just a moment that have been submitted prior to the broadcast, but before we do that, we are indeed going to toss it to Cam Smith, who is in the phone bank, to remind folks of how you can call in and ask a question. So Cam, we'll head over to you.
Thank you, Jason. We are here at the phone bank where we do have some of our volunteers standing by. They are ready to take your calls and answer the phones. So our phone lines, as Kelly mentioned, are going to be open from 7 o'clock until 8 o'clock tonight. We did have a phone just ring right there, so hopefully we get some questions out of that one. So you can call 554-5153. Again, that number 554-5153. Questions will be taken by our volunteers and they will be anonymous, so you do not have to provide any additional information, just your question to have them answered by our health professionals in the studio. So again, that number one more time, 554-5153, as our volunteers are standing by. They are ready and they are able and willing to take your calls. We can't wait to hear from you. So for now, we're going to send it back over to Kelly and Jason in the studio.
Thank you very much, Cam.
All right, so why don't we jump right into it with our panelists this evening. We've received a number of questions, and the first one is actually right about the vaccine, and it's that many are concerned, in fact, that the vaccine is experimental, as this individual has asked. What does that mean, and was it rushed? And I guess with you as our resident pharmacist, I think that's a good place to begin. So Dr. Albert, what are your thoughts about the vaccine being experimental? What does it mean, and was it rushed?
Sure. So to say that it's experimental isn't quite accurate at this point. It was experimental in the early phases of the studies. However, at this point, it's under what's called an emergency use authorization. So it does not have full approval at this time. So to explain that in basic terms, we have enough safety and efficacy data to prove that the vaccines are in fact safe to administer to people. And what that emergency authorization does is allows that vaccine to be administered, since there is no fully approved vaccine available for COVID-19, while we finish up some of the last regulatory steps in the approval process. And some of these vaccines are expected to be fully approved in the next few months, likely by the end of the summer. To answer the was it rushed question, I get that often as a pharmacist, that it came out too fast or this technology is too new. To answer a couple of those, the technology has been studied for decades at this point, so it's not brand new, even though some of them are new to market. And then secondly, how they came out so fast, some things that come to mind. The first one is study recruitment. So under a normal medication or vaccine that would be studied, it would take a while to recruit people for these studies. With COVID-19 so rampant throughout the world, recruitment was not an issue. We had tens of thousands of people willing to sign up for these studies. And then secondly, with the manufacturing process, governments around the world contracted for these doses to be made ahead of time. And once that safety and efficacy was proven in these vaccines, the doses were readily available for distribution at that time. So None of the safety checks were rushed in any way. It's more of the regulatory behind the scenes work that was a little bit quicker than usual.
I've heard it kind of described as, they had the formula, they just were kind of, switching up the specific illness. Is that kind of what it really looked like?
Right, so for both the mRNA vaccine and the adenovirus vaccine, they had been studied for other diseases. They ultimately had to tailor it to this COVID-19 disease in this case, which can be done fairly quickly nowadays with the technology that we have.
So I know we want to try to get to as many questions as possible. If any other provider would like to chime in on this one, we certainly welcome that, but otherwise we'll move on to the next. And the next question actually is about if you've actually had COVID-19, should you still get vaccinated? Or can I still get COVID-19 if I'm vaccinated is actually the question right here. So if so, how severe do those cases tend to be?
Yeah,
Dr. Griffin?
Sure. So to answer the question, can you still get the illness if you haven't been vaccinated? And the answer is yes. They're not 100% effective. There's no vaccine that's 100% effective. What we've found, though, is that even if you do get the illness, you're far less likely to get many symptoms, if any, and the chances of dying or getting severely ill and hospitalized is almost zero. It's amazing that on all the vaccines across the board, that's what we've seen, is that no one got really sick when they got the vaccine. So that's the good news about it. Even a vaccine that's like 94% effective, there's still 6% that could get it. So there's still going to be people that get it. And we've seen that, but I'm not seeing anyone get ill. The other part, as far as should you still get vaccinated if you've had the illness, and we are recommended that people do get vaccinated, because we don't know how long your immunity lasts after getting the illness, and we also know how good is it. The vaccine is very specific to what works best to prevent the disease. Your response to the whole virus, we're not sure if that's going to be enough to keep you safe for a long time. So we do recommend getting the vaccine.
The person who asked the question also asked that if they would get COVID-19, if they're vaccinated, does it mean that the vaccine didn't take, is what they're asking.
Right. Yeah, no, I think it still took, so to speak, because people aren't getting severely ill. They do mount somewhat of a response. It just wasn't as good enough to totally prevent the illness.
Okay. Did anyone else want to weigh in? I feel like that was pretty well covered. Well, let's move on to side effects. You hear everything from I didn't have any to I was severely ill after I got the COVID shot. And it definitely, a lot of people have noticed that, older people didn't seem to get as many side effects, while, when younger people started going in, you heard more about side effects. And this particular question is kind of, what are you seeing with teenagers now that they're getting vaccinated? And what do you expect to see as we have children even younger coming in? Are you expecting those side effects to become more severe? Or is it really going to still kind of look like what the 20 to 50-year-old crowd experienced?
That's probably a good one for you,
Yeah,
Dr. Foreman.
I have talked to a lot of the teenagers. We did one of the shot clinics at school today, and they're not really having very many reactions at all to the vaccine. A little bit of a sore arm. Some said they maybe felt a little bit, fatigued the next day, but they seem to be tolerating the vaccine very, very well, the kids. So I'm not too concerned. A lot of them are just getting their second ones now. I have some kids who already got their second one and they've done fine with it. And I expect that's going to be the case as we get younger as well. Kids tolerate vaccines very, very well, better than adults do for the most part.
I know many parents are wondering when might that younger set be. Do you have any insight on when the next round will be for younger children?
What we've heard is that they're going to go for emergency use authorization, by the fall. Whether that timeline gets pushed back or not through earlier in the summer remains to be seen. I personally hope it does. I'm hoping that we can get those younger ages in before school starts. But I think they're looking more towards the fall, September time.
Okay, and we have a question a little further down the page, so I'm just going to kind of skip to it because it kind of goes along with what we're talking about. Somebody said, my child is 13 years old and eligible for the vaccine. How safe is it for me to have my child vaccinated?
It's very safe and it's very effective. And actually the 12 to 15 year old data is incredibly impressive as far as the percentage of them being protected. So the younger that we're getting, the better the numbers are looking. Yes, it's smaller sets that are being studied, but it's a very safe and effective vaccine. And I know there's a lot of fear out there, but I recommend highly. Kids are tolerating it well, and we're seeing nothing in the data that's coming to tell us otherwise.
Let's take that for a moment and ask all of you to comment on this. There are a lot of folks that are saying that they're still fearful at this point. What are people telling you that they're fearful of, and how are you advising them? How are you talking to them about those fears? Why don't we start with you on that, Dr. Griffin, and we'll go around.
Yeah, the side effect is probably one of the things, and the so-called rush to getting the vaccine out is probably the other one. Just the other day, someone stopped me in the hall and asked me about the children thing. They said, have you gotten your, I have a 15-year-old, and they asked me if I'd gotten mine vaccinated, because they were worried about, what it's going to do to them. And I certainly reassured them. I was never so happy when my son got done, so now my whole family's vaccinated. It makes such a difference. It's so freeing for your family and everyone. You don't have to worry about every time, oh no, it's an exposure. Now we have to isolate, and it's been very good to get them vaccinated.
Dr. Fournier?
That's pretty much what I've been hearing as well. How do we know what long-term this is going to do to children, or to adults for that matter? There's a lot of things in this world that we expose ourselves to that we don't know what long-term is going to do, but we do know what COVID can do to us long-term. So we need to take our risks and our benefits and put it in that perspective. All the evidence, all the data, all the studies are showing us the safety of this vaccine. And I would be very surprised to see otherwise. So I just try to reassure people that, we need to go with the numbers we have, and it's very reassuring at this point.
Jordan, Albert, are you hearing differently in the St. John Valley? Are those very similar fears that folks are sharing?
Yeah, I think those are very similar, but in addition to that, there's so much misinformation or twisted truths that are shared through social media, and this COVID-19 epidemic was covered so much online that I would just warn people to get their information from a trusted source. There's a lot of mistruths out there. Social media is not the best place to research vaccines or to base your decision off of. Neither are some websites that are riddled with advertisements or wanting you to click on ads for them to make money. So get your information from a trusted source, your physician or community pharmacist, or even CDC website, immunize.org. There's a lot of reputable information out there.
Jose Roman, you're working with an immunocompromised population on a daily basis. I'm sure you're hearing those questions heightened even more.
Yes, we do hear a lot of those questions because a lot of our patients are actually actively going through chemotherapy and immunotherapy. A lot of other questions are, will I even mount a response? Is it even going to be effective? And we tell these people that yes, you will mount a response, even though it might be somewhat reduced from the general population. We still say that a vaccine is better than no vaccine, so we do recommend that they get it despite going through chemotherapies. We have some pretty good preliminary data coming out of multiple major hospitals and major cancer clinics that show that they've been doing the same, and that the patients have been tolerating it very well.
And kind of to follow that up, it really dovetails nicely into this next question. Are there any medical conditions that would prevent me from being eligible to get the COVID-19 at this point? I know a lot of people are asking, like, well, if I have cancer, can I get it? If I have this, can I get it? Are there any that really shouldn't get it?
Just people who have had an allergic reaction to it. At this point is really the only contraindication, so to speak, that we have to the vaccine, or an allergic reaction to a component of the vaccine. Other than that, there doesn't seem to be any recommendations to not vaccinate.
And is an allergy, Dr. Fournier, to one, meaning that the three variations of the vaccine that are available to folks, the odds are you're going to be allergic to all three, or?
I'm going to defer that to Dr. Albert.
Likely, if you had an allergic reaction to either the Pfizer or the Moderna, then you could get the Johnson & Johnson, knowing that there's precaution. They'll probably monitor you for 30 minutes instead of 15 minutes after your shot. And inversely, if you had an allergic reaction to your Johnson & Johnson vaccine, if you still received the dose, then you're still fully vaccinated at that point. You wouldn't need the other.
And are there any indications that there, I know like when you get the flu shot, they ask you if you have any allergy to eggs. Is there any, anything people can know that might give them a hint that they could potentially have an allergic reaction to any of the vaccines?
So in the past, people have been concerned about egg allergies or latex allergies. There are no concerns for those with these vaccines. There's no latex in the vial, and no egg proteins, no gelatin, nothing like that in the ingredients. The ingredients are very transparent. They're available online. We provide an ingredient list at the time of vaccination. One of the ingredients in the Pfizer and Moderna vaccine that is shared is something known as polyethylene glycol. It's part of a chemical that helps mount the immune response and keep the vaccine kind of at a steady level in the body for a little while afterwards. If you have a known allergic reaction, severe allergic reaction to that, then you would want to avoid that and use the Johnson & Johnson instead.
And do you think the allergy issue is preventing some people who think, well, maybe I will have that allergic reaction from getting the vaccine?
Yeah, I've actually talked to people about they've had a history of severe allergies to other things, and they kind of have it in their head that they're going to be allergic to this. That's not necessarily the case. An allergy to polyethylene glycol is extremely rare. We're looking at 1 in a million at this point, or statistics may have changed roughly from time to time, but it's extremely rare to have a known allergy to these ingredients.
And I'm going to sneak one more question in, and then Jason, you're on. But for people who have the allergic reaction, is it a reason to not get the vaccine? I mean, has the reaction been severe enough to say it would be wise for you to not get your second shot? Or, is it enough of a risk for people to say, well, I might have an allergic reaction, maybe I shouldn't get the shot?
Right, so if you had a severe allergic reaction, what would be known as an anaphylactic reaction to your first dose of Pfizer or Moderna, that's where you would be contraindicated to your second dose, like Dr. Fournier was explaining. That's when, after a month after that reaction, you could get your Johnson & Johnson dose, since it does not have the same exact ingredients as the other two.
Okay. So another topic, we're going to shift topics a little bit here, that many people have been asking about, including some community members here in Aroostook County, relates to the question of women of childbearing age looking to have a baby. One person asked here, I've heard the vaccine could negatively impact my ability to conceive. Dr. Griffin, I know that you've had a background in family practice. Your thoughts and how you're advising your patients related to this particular question about conception and fertility.
Yeah, and this is a concerning thing that people are talking about, because it's a big chunk of the population that are concerned, understandably. And as far as where that comes from, it's a little hard where that all came from. It certainly didn't come from any studies, or it probably someone mentioned it in social media, that somehow the vaccine would attack the placenta where it attaches to the uterus. And that is totally different than the spike protein, is what we're going after with our vaccine. So there's been good data to show that there's no evidence that this affects your ability to have pregnancy, and it doesn't affect the pregnancy itself. And during the studies, they had a number of women that became pregnant during the study programs, and there were no issues there either. So in the American College of Obstetrics and Gynecology, on the webpage clearly states that it's definitely fine for either women that want to get pregnant or are pregnant. There's no concerns at all there.
No concerns for infertility or anything like
Correct.
that?
Yeah, there's no science behind that one.
What about in terms of for newer mothers who are breastfeeding? Any concerns or thoughts on that? I know, Dr. Fournier, you're a pediatrician, so
Yep.
you see children very young age and
There's
their parents.
been actually some data that's come out that is showing both babies after birth to moms who were vaccinated during their pregnancy are coming out with antibody levels through cord blood, and that they're getting protected through the breast milk as well.
And that's
So
safe.
we're hoping that those numbers continue to show that, but that's safe, yes. That's safe and protective for the child.
And obviously, anybody can probably weigh on this one. There has been some concern that microchips are being put into arms. It's a question that we have here. Are you still hearing this as a concern in the community? Do you think people are still feeling this way, or do you think that's something that's kind of dying down now, and people are, I mean, I don't know if any of you tried the magnet on the arm that I've heard about. So, I mean, is this something that you're still seeing as a concern for people in the community?
For me, probably it's not really been the major concern, at least in the oncology patients that we see. For the most part, they've never been substantiated. There's been nothing to basically even say that there's even an inkling of anything extra in the vaccines at this point in time. So, because obviously it's one of those things we have to make sure, especially for our patients, they have to be very safe. So we vet these vaccines as well as we can.
Let's just continue on that topic for just a moment, not necessarily microchips, but with your patients in terms of adverse reaction after the vaccine. Is there more of a predisposition to that for immunocompromised patients that you're working with, or is it what you're seeing is consistent with the general population?
If anything, it's slightly reduced from the general population, because especially with the way that their immunotherapy and their chemotherapy works, their immune systems are already slightly reduced in a way from the chemotherapy that we give them. So like I was mentioning earlier, to give the vaccine, we want to make sure that we give them the one with the most efficacy, which is usually the Moderna and the Pfizer. We do also recommend the J&J if they're able to get it, but to mount the best response that they can and to give them at least the best chance of getting that response, we usually recommend that they go with the Moderna or the Pfizer. And usually we don't, we try to time it in the cycle of their chemotherapy so that they are off certain medications that would also bring down their response to the vaccine. But if they aren't able to do that, or if they're too high risk to wait, we give it without consideration. We just say go ahead and get the vaccine and we'll go with it.
You mentioned in your comments about recommending a specific vaccine, and during the 6 o'clock news, actually, when the live shot was done, there was a person who called in and actually asked, can a person choose which vaccine they receive? And I think that's something you can do, correct?
Yeah,
I think so. I think all of the hospitals up here offer all of them. There are places you could definitely, find that are giving the vaccine you choose to get.
And how do you find out which one you're getting, or know for certain which one you're getting?
typically it's based on the clinics that were being held. People were able to sign up for the specific vaccine that the clinic was being held that day. Say, Northern Light was doing the Pfizer for a while. People had the option of signing up for that. We were doing the Moderna and the J&J when it became available. So people were able to sign up for whichever vaccine that they wanted to get.
Okay, and it's
definitely
sorry.
gotten more loose as far as that goes. I mean, if you asked us a month ago or a little bit more, we'd say, oh, get it what you can get. But now
Right.
the vaccine is really pretty ready available.
Yeah.
Most places offer all of them or some of them, and you can go to one place and get your second dose at another place too. So.
And I know when I went online, it was very transparent in terms of which one
Which
was
one you were
going
going
to
to get.
Yeah.
Yep. And is there a vaccine that is most effective? Is there a reason to choose one over the other if you have, with the option of the three?
I think if you're healthy, and not dealing with immune suppression or immune compromised conditions, take what you can get and get yourself vaccinated.
Dr. Albert, any input on that question?
I think early on there was some hesitancy to the Johnson & Johnson because on paper its efficacy number was a little bit less than the Moderna or the Pfizer, which are about 95. If you're looking at Johnson & Johnson, roughly 66% worldwide. Something to keep in mind is that Johnson & Johnson came to the market last. There were more variants circulating at that time, so it's difficult to say. You're not weighing apples to apples. It was a rapidly evolving winter season. Things changed quickly. Johnson & Johnson came out a few months after, and it was a very different ball field for them. So.
A question that's somewhat related, Kelly, that also came in from a caller is, do you have to provide your information when you go to receive your shot, or can you do it anonymously? Dr. Griffin?
It's a good question. I don't believe you can do it anonymously because they need the information to go in. So we just keep track of it. That's how we keep track of side effects and such. It's a very robust database to make sure that things are working out well. So you have to at least provide some basic information to get the vaccine.
Do you think at some point there may be an option for an anonymous COVID? Do you think they'll kind of not track it as closely as they have been over the last few months?
I'd be very surprised. I doubt it.
Okay.
For any other immunization, you're gathering basic demographic information,
Right.
so I would expect that would continue.
Okay. Well, this seems like a really good place to pause our conversation. And we are actually going to hear from a few people who have received the vaccine. And
Yeah, Kelly, as part of the Don't Wait, Vaccinate work that's been done countywide by the Aroostook Public Health District, there have been several individuals from one end of the county to the other that have shared their reasons for getting vaccinated with us, and we're going to hear from them now.
The reason I chose to get vaccinated was because I had trust in the science, and I decided that it was my obligation, really, to get the vaccination. I wanted to protect myself, protect my family, protect my grandchildren, and protect my coworkers. I just think that this is a pretty unusual situation. It's something that most of us have never seen in our lifetime, and hopefully never see it again. Another reason for this is the healthcare industry has had it pretty rough, and they've worked extremely diligently to come up with a vaccine. And I feel like it's the least that we can do is to participate. They've come up with something in a very short period of time to solve this problem, and I think it's our responsibility as citizens to participate and get the vaccine, because it will get us to the finish line.
The obvious choice was for my family. I'm in the public every day working around customers, our staff, and I just felt number one priority was my family. Number two was my staff and our customers. It's real important. I felt, I'm in 3 different communities almost every day, and being around a lot of people, I just felt it was the best thing to do. The other reason really is just getting back to normalcy, not just for our family, but for the communities and everybody that supports us. Everybody's looking forward to getting back to normal and getting back to a regular way of life without having to worry about COVID and the scares that go along with it.
We chose to get vaccinated because felt strongly that every person has a part in trying to stop this COVID. I want my children to be able to go to school without masks. I miss traveling and hugging people and really being able to socialize. Restaurants, I miss going out to eat. And it's all of those small things that really contributed to why we chose to get vaccinated.
So I chose to get vaccinated first and foremost for my family, but also for my employer to help keep the staff and my customers safe.
The biggest reason for deciding to get vaccinated was for my elderly parents. Both my parents are living. They're in assisted living and nursing care. And it was heartbreaking when COVID hit and the restrictions of being able to see them got really, really tight. And I was afraid that that I wouldn't be able to see them. We went a couple of months where they had total lockdown. Thankfully, my parents have a mobile phone, and I could call my mom at least and speak to her. But I decided to get vaccinated because I wanted to be able to see them as quick as I possibly could. And I felt that being vaccinated gave me that edge, or gave me the in to go see them. I miss them.
I was on the fence about it for a little while because I'm pregnant, but the more I thought about it and the more research that came out about it, I felt more comfortable with it. And really the effects of COVID in pregnant women and the lasting effects that it can have are much worse than any effects that the vaccine has shown. So I felt like I should get it to protect myself and my family and my patients too, because pregnant women are a vulnerable population, so I wanted to be able to protect them the best I could.
Everything is around safety, and this COVID really scared us. And the way that it transferred from one person to another, it would be so easy to be around other people, and if we did develop something without knowing it, to transfer it on to somebody else would be absolutely terrible. And we didn't want somebody to be able to transfer it on to us. So the COVID shots were just common sense. And As soon as it was available, we did. Right away, we applied and got into the first groups that went in. And later, we helped schedule other people get their shots.
It's protection. It's all about self-protection. And we had the COVID shot because we wanted to be protected. We wanted to protect ourselves, protect you, our neighbors, our family. And that's every bit as important as putting on safety glasses when you go to the range, ear protection when you go to the range. So to us, the arsenal is not just guns, bullets, and how you shoot at a target. It's all about how can you be safe around a firearm and protect yourself as well.
Welcome back. We're now going to head over to Cam Smith again, who is still in the phone bank room. Hi, Cam.
Hi, Kelly. Thank you so much. So we are here with Dr. Cameron Grange. Dr. Grange, you're here on behalf of Fish River Rural Health. You also have your master's in public health. So thank you so much for taking the time tonight. So we do have a few questions for you. So one question that we did receive is about taking Tylenol. So will taking Tylenol both before and after your vaccine impact the body's response to the vaccine?
Okay. So the short answer is yes, it will, but the long answer is not as much as you'd think. Tylenol, one of the reasons most people take it is to decrease a fever, and a fever is a vital part of creating an immune response. Our immune system is kind of running standby during our day-to-day life, but when we get ill or when it gets activated, that's when our temperature increases, and that's one of the first signs of the immune system being activated. That's when antibodies are made, that's when they bind better, that's when our white blood cells start fighting and do a better job. So taking some Tylenol before does weaken that, but not significantly. What I would advise is don't pre-medicate before vaccinating, but if afterwards you're feeling sore, you have a fever, nothing wrong with taking a little bit to get you through that. Mm-hmm. You're still going to be immunized. You're still going to have a response.
Awesome. And another question that we did get is, in terms of generally, what are you hearing in the community? What kinds of things have you seen in your practice from folks in the community that are, either hesitant about getting their vaccine or are just curious about, how is this vaccine going to impact me, that sort of stuff?
Well, currently the main concern that I'm getting is that individuals don't feel like they have enough information. When I ask my patients what questions they have, they don't know what questions they have. They don't know what information would tip them over to make a decision and either feel comfortable with it or not. That's the response I'm getting, and I would challenge or invite anyone who is on the fence to sit down and think about what information would help you to make up your mind. Chances are the studies or the data is already out there in one shape or another, and we just need to find it from a trusted, valid source. That's another thing that people can consider is what source would I trust my information from? Because that's one that a lot of people still question.
Definitely, and in terms of some of those concerns, when you do get a patient into the office and maybe they're on the fence, they're not sure whether they want to get the vaccine, they're not sure whether it's right for them or not. What kinds of things do you tell them? What kinds of things do you do to kind of ease some of that concern and to kind of address the idea of vaccine hesitancy?
So the main questions that I ask is what would motivate you to receive the vaccine? Is it for your own personal safety? Is it out of concern for a loved one? Is it the ability to go back to normal? Because we all have our different motivations, we all have our different fears, and helping to identify what those are helps us to individually and as medical professionals to figure out what information you're looking for to answer your questions. And at the end of the day, that's what our job is to present to you the information so that way you can make the decision that you need to.
Mm-hmm. Awesome. Well, Dr. Grange, thank you so much for answering these questions. We do have some info for you. So to ask a question to get to our phone bank, that number is on the bottom of your screen. It is 554-5153. We also do have additional information where you can go to find that info is maine.gov/COVID-19 /vaccines. So if you visit that website, tons of information at your disposal about the COVID-19 vaccines. You can also call the community vaccination line at 1-888-445-4111, and you can also schedule a free ride to your vaccine appointments by calling 1-855-608-5172. So again, those phone lines are going to be open right up until the end of our broadcast. And again, thank you, Dr. Grange, for taking the time. You are going to be in here answering some questions from folks over the phone, so be sure to call in if you do have any questions. For now, back to you, Kelly and Jason.
All right, thank you, Cam.
Yes.
So Kelly, one of the things that Dr. Grange and Cam were talking about, and to our providers here in the room, is that he has had patients, and I know you all have as well, have conversations with you about their vaccine hesitancy perhaps. But the reality is more people have not had those conversations than have, and this may be the opportunity for people in Aroostook County to have a conversation with a provider. Would you encourage folks who are on the fence to have that conversation with their trusted medical provider, Dr. Griffin?
Yeah, absolutely, and I agree. I have not had a lot of people asking questions, and I would love them to, so that's why I was happy to do this panel, because we can get the information out. But anytime, I'm more than happy and love to talk to people about this.
Now, if they don't have a primary care physician, if they don't have someone that they see regularly, I think a lot of people fall into that category, where can they get that information locally? Are they able to call hospitals and ask some of these questions?
I would be happy to have people call my office and ask, or just, have somebody get in touch with them. I'd be happy to answer any questions people have. I understand the fears, I understand the hesitancy. I want to reassure people because I want people to get vaccinated so we can move forward.
And Dr. Albert, is the same true for you as a pharmacist? And I know that there have been pharmacists in private practice, if you will, in county pharmacies that have been involved in the Don't Wait, Vaccinate effort and the communication campaign. Is a pharmacist a good resource that you can call, pick up the phone and ask a question to as well?
Yeah, absolutely. I mean, pharmacists are available really without an appointment anywhere. You can pop into any pharmacy and ask a question right on the spot. So that's also a great resource to get your questions answered.
Okay.
Right, so Kelly, we got some questions that have come in from the phone bank.
We did while we were watching the 5-minute video. So the first one is, this person is scheduled for a mammogram and they're wondering, is it okay for them to get vaccinated?
I mean, as far as we know, it is safe. I've not heard any reason not to vaccinate before a mammogram or any other screening.
Okay.
Dr. Albert, had there been any messaging around that with Northern Maine Medical Center?
There was early on a theoretical thought that lymph node swelling might disrupt some of the imaging. So if a routine mammogram was scheduled, then you could possibly delay that apart from your vaccination. That is not an absolute contraindication to getting the vaccine by any means, though.
Well, Kelly, a number of questions have come in along this line, and it was about, I think, the concern that folks have had as we have, been able to take off masks in certain settings and the like, and that's the thought about unvaccinated people identifying themselves. Or even one caller called in and said, when we vote, we receive this "I voted" sticker that we put on. We should wear this pin on our shirts after getting vaccinated, this caller suggested, so that it would help us better understand, I think, who we can and cannot be safe around. Do you have concerns about this, percentage of population? We are all hearing there's a certain percentage of population to reach herd immunity, and we're sort of in that precarious in-between where some have been vaccinated and some have not. It seems like this is a primary concern of folks here in Aroostook County.
Mm-hmm. I think that's a tough thing to really consider doing for many reasons. I would love to be able to do that, but I think that it's become very politicized, and I think that's going to make it difficult to go down that route. I would hope that people who are choosing not to become vaccinated at this time would ask questions and hopefully get their concerns answered, and then mask up appropriately in situations to protect others in the community in the meantime. So I'm not sure if that will become something we can do.
But obviously, to all four of you, the fact that we have been told it's okay not to wear a mask in certain settings doesn't mean that it has to be an absolute certainty. If there's a level of comfort, obviously, in continuing to wear masks. I mean, I know even going into large crowds or places where there are lots of people and you don't have that information, obviously wearing a mask is not taboo at this point.
Correct.
It's at this point in time, I look at it as better safe than sorry. You protect yourself as best as you can, and you protect other people. This isn't something that basically this isn't something that it's all about one individual person. It's about the community as a whole. So everybody has to work together to get to that herd immunity that we keep talking about. So everybody doing their little part is necessary.
And this person called in and said, across the board, how many people are afraid of needles? Is that why people are not getting vaccinated? And is that, I mean, there are some people who are absolutely terrified of it. Is that playing a role in this?
Oh, it absolutely is. Yeah, some people are just, I mean, they may not say it right away, but if you dig in, and that's why now a lot of our vaccination efforts are getting on the one-on-one, what is going on, and some of those people that are just deathly afraid of needles, and you don't know who they are. You can't tell by looking at them. It could be a big, strong guy, or, you know. And so dealing with them on one-on-one is the way. Sometimes we've had people go out to their house and do it, or do it in a place that feels safer to them, not coming into the hospital. We've tried to be more flexible for these people because they really need that.
When we're talking about in regards to that vaccine selection, I'm going to stand in line and admit that, you know, the Johnson & Johnson one was attractive to me in part because of that. Is that a good way to help somebody through that anxiety? Say, let's focus on this one.
Yep, I think so. I think if the needle phobia is a big part, then we just have to get them there for one.
Right.
That's all it's going to take.
So this question is related to a second shot, and this viewer, and we talked about this a little bit, why does it seem that people are getting sick after their second shot? And some people say that it's more after the second shot than the first shot.
Because it's the way that the vaccines work. You mount an immune response. You show, with the first shot, you're giving a little bit of an antigen or that spike that we talked about to basically prepare the body and mount part of that immune response. With the second shot, you're basically igniting that memory and saying, okay, let's go more after this and really put that memory for future exposures.
So what is it that causes one person to have a more severe reaction to a vaccine than another person? What is it that seems to be the key to that? Any ideas?
Yeah, that's a good question. I don't know that we absolutely know that, because just because you got sick or didn't get sick doesn't necessarily mean you're a better responder or not responder. So we like to tell people, well, that just means you're responding, that's why you're so sick, because it reassures them. But people that don't get all that ill still get a good response. So it's kind of unclear why some people get more of a response than others.
Is it a myth? I've heard this one. Is it a myth that folks who get more sick after their vaccine, that would have been an indication of, had you contracted COVID, if you hadn't, that would have been your path, you would have been more likely to be sick from COVID and symptomatic?
Yeah, I've heard that out there, but I don't think so, because I know a lot of people that definitely do not have it. It's got bigger side effects than others.
I've also heard that it's an indicator of how strong your immune system is. That if you have the stronger response to the vaccine, then your immune system is stronger, versus if you didn't have a reaction at all, maybe your immune system is not very strong.
Yeah, probably not. Certainly we've seen in the elderly, they tend to get less of a reaction, and they probably don't get as good a response just because they're elderly, but I don't think across the board that we could generalize like that.
Dr. Fournier, one of the questions we had in advance was from someone who has a 3-year-old son, and you indicated that it would likely be potentially fall before the vaccine would be available for the younger children. This individual would like to know, what is the best way for me to keep my 3-year-old son safe from the virus in the meantime?
Vaccinate everybody in the family who's eligible. Daycare providers, anyone that the child spends a lot of time with, encourage them to get vaccinated. Continue to mask your children in public. Those are really the best ways to prevent them from getting the virus. But vaccinating those around them decreases their chances dramatically.
Okay. So we mentioned this earlier in the show a little bit. We talked briefly about booster shots. And I know there's a lot of, there's some confusion anyway as far as when you get your vaccine card, there's an expiration date on it. So, the vaccine expiration date, should I be concerned that my vaccine may, according to my paper, expire before any booster is available?
So that expiration date on your card is just when that vaccine was viable in storage. It should be administered before that date. That has no indication on how long that immune response will last in your body. And this data is changing very rapidly in terms of the necessity of boosters. Right now the data is looking for about a year of protection from when you got the vaccine. That could change as we get more data from more people being vaccinated, and the longer that we can look at the early study participants in the trials of these vaccines. So we can't say for certain if boosters will be needed or not at this time.
And that you're right, that has changed. I think folks initially thought that a booster might be necessary by fall heading into the flu season, but now you're hearing it could be as much as a year, or there's still a lot of question around that.
Right, well, when the vaccines were first available for the public around the holidays, the new year, it was said that 3 months was how long we knew the immunity would last for, and that's because that's all the available data we had at the time. 3 months was the longest we could look at, and now as time goes on, we have more and more data. Now it's looking more like a year. That could look different by the end of the summer. Maybe it's going to be longer than that. But we'll have more information as time goes on.
Does someone, I just want to address this, and I know it's not necessarily a medical question, but folks who are skeptical about receiving the vaccine, when you hear something like this and the goalposts kind of keep changing, or the mandates around masks have changed throughout this virus, does that add to the fear and the hesitancy from what you're hearing from patients if they're having those conversations with you?
I think so. And I try to encourage them to keep in mind that things change because we learn as time goes on. We're learning more about this virus, we're learning more about these vaccines, and that's why recommendations change. And the more data we collect, the better advice we have to give to them. So, I just try to encourage them that changing information is not necessarily a bad thing.
You're looking at me, so I think that means I'm up. So this question, will my doctor continue to treat me if I'm not vaccinated? And what might that look like in the short term, long term? I feel like all four of you could probably weigh in on this one.
Yeah, I don't see any reason why you wouldn't.
Right.
I mean, there's a lot of things in life that people choose not to do, even though we recommend it, and we just deal with it and go the best we can.
Your Hippocratic oath would prevent you from not treating a patient, I should say.
Now, along those lines, do you see that becoming something where schools might say, if you're going to come into school, this is a vaccine you need to have? Do you see that maybe coming down the line?
We're already seeing it in colleges. Everywhere, lots of colleges are requiring it to enter. And I wouldn't be surprised if down the road the elementary and high schools and middle schools start to require it as well.
Let's take it to that level, because you mentioned earlier in the broadcast that you were actually in a clinic today in a high school setting.
Yeah.
What are you hearing there from the youth? How is that population differing from their parents? How are their parents' interactions?
Yep. Right. The kids want the vaccines. I'm not hearing too much resistance from the kids. They want the vaccines. They want to get back to life as they knew it before. They want their masks off. They want to go to school and be with their friends. And the vaccine is their way to do this. So I have a lot of discussions in my office, and I have to convince the parents, not the children, to get vaccinated. The kids are ready. They've been wanting it. So they're coming out as long as they can get their papers signed by their parents. So, we encourage those conversations, and if parents have concerns, talk to us.
Are any of you having conversations with school-age children, your own perhaps, about this topic? Or?
Well, I have a 5-year-old at home, and when my husband and I got our vaccines, he was also asking, when am I getting mine? So it is something that definitely I'm seeing and that we're seeing with our patients.
And it's been interesting to me because the needle phobia, obviously we deal with that a lot in our office. And most of the kids that we're vaccinating in the schools, our children I know have struggled with vaccines in our office, and they're having no issue with it whatsoever. So,
and are they coming in asking really great questions? I mean, they must be curious as well. And
the kids are.
Yeah.
Yes.
Are you finding that they're asking great questions along the lines?
They
of
really
vaccines?
are. They're educating themselves. They have very good questions. You know.
So let's look at this generationally. Aroostook County came out really swinging at the beginning because we have a high geriatric population, a high number of older citizens in our community. And so we soared initially, and it seems like we're settling back down. And what you're seeing, and most of you are experiencing, is younger people, those that were just recently added to the list of folks able to get vaccinated, seem to have a greater interest as well. Is it this sandwich issue? Is the meat the issue in this one?
Yeah, I think the numbers we're seeing is that 20 to 40, 20 to 50 age range are the ones with the most questions and concerns.
Yeah, that's when we saw the big slowdown, is when we got past that 50 group starting down, it really slowed down a lot after that.
And I know this is probably asking you to speculate a little bit, but what is that? Is it the news around J&J that was coming out at that time? Is it, we've talked about, the political debate that's happening? What is that? What is stopping that 20 to 40-year-old group or causing that hesitancy? Any insight?
A lot of the fertility questions in the younger generations. I think a lot of the college age just don't feel that, they need to.
Invincible.
They're not getting ill. Right, exactly. So that's what I'm seeing a lot of.
I think so. I think part of it, we've forgotten how bad an illness it is.
Yes.
It's still out there. We're still seeing cases and people are still dying from it. So that's the thing to remember, is it's still there. Yeah.
What are some of the top questions that you're getting from the kids when they come in?
Side effects. They want to know how they're going to feel after. The kids don't have a lot of questions. The parents are more concerned about long-term side effects, what we don't know for 10, 15, 20 years down the road. That's the biggest question from the parents. But the kids don't have a lot of questions. They really don't. They just want their masks off and to go back to life as they knew it before.
Along those lines, yes. Along those lines, we had a question that said, are there any studies being done right now on birth defects for babies born to moms who have been vaccinated? Is that something anybody is looking into?
I think we need to remember that they're constantly gathering data from this. So no matter what, if we're going to find any sort of reaction in that regard, we'll probably know down the road. But again, the data has to be there.
Okay. So why don't we go on to this one, because we're actually coming to the end of our... This has gone so fast. But what if we kind of go with this, maybe asking each of you, what are the benefits to getting vaccinated, and what are the risks if you don't get vaccinated?
Why don't we start with you, Josie, and we'll just work around.
I think, at least for me and the patients that we see, the risks of not getting vaccinated are quite high. We're dealing with a population that already has a very severe illness and a very overwhelming issue to begin with. To be exposed to COVID is potentially detrimental to them. So we always try to put that into perspective when they have such questions about the vaccine. Are the long-term risks of getting COVID, the ongoing shortness of breath and the tiredness and the potential for clots, is that acceptable to you versus a few days of feeling tired from the vaccine? So I think that's the biggest thing that I try to remind my patients about.
Jordan Albert?
I think there is a common misconception that COVID is just like the flu for most people. You'll get over it in a couple of days and you'll be fine, and that's actually not what we're seeing with a lot of patients experiencing what's known as long COVID, these symptoms that are going on for months and months, even though they've recovered from that acute phase. So it's important to understand that COVID is a very severe illness, even though the case counts are dropping. So that is obviously a risk of not getting the vaccine. Your chances of getting COVID are still fairly high. And then the benefits of getting vaccinated are, we spoke about the efficacy numbers earlier. There's a very high percentage that you will not get symptomatic COVID whatsoever.
Okay, we're down to a little less than 3 minutes, but we'd love to hear from you.
So in addition to what they both mentioned, the biggest issue from my perspective is, you know, as I've already mentioned, we want children to be able to get back into this world and get back to school and not be quarantined. And this is the way to do that. Getting your child vaccinated, getting yourselves vaccinated will prevent your child from being sent home for 10 days. It will allow them to do the activities they want to do, to be with their friends, and to be learning in school again. And that's a big, big positive.
Okay.
Yeah, the one thing I just point out is that we've been through a heck of a year with masking, social distancing, and that's helped to keep the cases down, but it wasn't until the vaccine started that we really saw a reduction in cases, and now we're sitting here without masks, which is just wonderful.
Yes, it is nice. We can breathe.
Yeah.
Well, it's been a fascinating discussion, and certainly those of you who have been calling in, if you've had the benefit of talking with Dr. Grange, one of our phone bank operators, we've really appreciated that addition and the conversations that have been happening with the phone bank. We've really appreciated the viewer participation and the calls. We've gotten some really great questions, and we're really hoping that this conversation has helped to at least help you with your decision, and that was really the intent of it. We're not here to tell you what to do, but we want to make sure that you understand and you can have this conversation.
All the information that you can have. And actually, along those lines, we're going to throw up that graphic one more time that has the phone numbers on it and the website. If you would like more information after this special is over, you are free to call those 2 lines or to go to the website as well. And as we've heard from our panelists this evening, they're willing to take some phone calls from you as well for a more personal one-on-one conversation instead of on television to get that information out.
And in fact, folks, even in the St. John Valley, if you have a question and prefer to speak in French, they do the COVID vaccination hotline, the number that was up on your screen. They do offer different languages or services in different languages. You can also reach out to any one of your federally qualified health centers, the 4 hospitals in Aroostook County. Your local pharmacy as well has that information.
Absolutely. So we want to take just a moment to thank all of our panelists and to thank those who have been answering phones, and again, Dr. Grange in the other room as well. So thank you for joining us, and we hope you have a wonderful evening.
And thank you, WAGM, for providing this forum. Thank you so much. All right, we just completed the Don't Wait, Vaccinate, Your Questions Answered forum, and Dr. Grange, you were very gracious to be with us on the phone. We had some callers who called in whose question we didn't get to, so we're going to ask you to help us with that now to help answer those questions so that we can put them out electronically. One of those questions was that the individual who called heard today that if you get the meningococcal vaccine or the vaccine for meningitis, that you need to wait so many days to get the COVID shot. I've also heard that from my father, actually, who got the chicken pox or the adult chicken pox, the shingles vaccine, that was the case as well, and that was the advice from his provider. So is that in fact the case?
That is the case, and it's not unique to the COVID vaccine. It's pretty much you can receive any number of vaccines at once, but you should wait about a month between vaccinations. So that way, whatever vaccines you receive have a chance to get a full response rather than kind of a stuttering rollout.
Great. So it's not only for meningitis, it's for other vaccines as well.
Correct.
Great. So the next question was, how long should you wait from one vaccine to get the COVID vaccine? And you've pretty much covered that. A month is about a month. Okay. Had this individual called in and said, I have COPD, is it safe to get the vaccine?
Of course it is. In fact, that individual should get the vaccine more than someone who doesn't have COPD, because the question isn't, is the vaccine safe, but what is worse, getting COVID or getting the vaccine? And the vaccine is much safer.
All right, so the next question, somewhat related, not necessarily through COPD, but the individual said, my wife and I have been vaccinated and other family members have been vaccinated as well, but we have family members coming from out of state that are not vaccinated. What is the possibility of us, vaccinated folks, getting COVID and passing it along to someone that has not been vaccinated?
I would like to say that the chance or the probability is nothing, but unfortunately that's not true. There are individuals who have been vaccinated who do get COVID and pass it along, but it is very, very small. The last numbers I was looking at said that even less than half a percentage. So nothing in this world is perfect or guaranteed, but it substantially reduces both your chances of getting COVID, and if you do get COVID, it reduces the severity that you have.
And I know we talked about this next question on the special, but this individual asked that specifically last December I had COVID. Should I still get vaccinated?
Of course they should. We don't know how long the immunity from an infection lasts, but the data looks like it's not as long and it's not as strong as when you get the vaccine.
This next question actually we didn't cover during the hour-long special, and it's if I got the Moderna shot, will this cover the variants that we're hearing about?
To the best of our knowledge, yes. We don't know what variants are going to come out, and that's something that we're looking at quite rigorously because we want to know and we want to be assured that the vaccine that we all receive is still good.
All right, this next question we also didn't cover, and this individual is calling about the fact that they had a stroke a year ago. What would the vaccine do to this individual?
The vaccine wouldn't have any additional side effects. So if they got the vaccine, they'd be subject to the same reactions that a normal person would, which are fevers, myalgia, nausea, vomiting. If you get the Moderna, there's an interesting one where you get a red spot on your arm for a couple days, but having a stroke doesn't put that individual at an increased risk.
So, Dr. Grange, the last question for you. We asked it of our panelists on air. How are you advising patients, and what would you say to someone, and what have you said to patients who have asked you about the vaccine?
Well, full disclosure, I am a proponent of vaccines, so of course I'm going to push that. But what I've been telling my patients is to make sure that you get your questions answered. Make sure you're feeling comfortable with the decisions you're making. There are a multitude of reasons that people are getting immunized. One is, well, like the individual with COPD, to protect themselves. The other, the family who has family coming from out of state to protect others, and others within their family circle. And then there are some people who see it as a civic duty. And honestly, I even see some individuals who are getting vaccinated so that way we can return back to normal and reach that magical herd immunity. If having questions is a good thing, but what I would challenge anyone who is still considering to think about, what exactly are my questions, and where would I trust the sources of information? Once you have those two pieces of information, then you can get your answers. You can get answers that you feel you can trust.
Well, Dr. Grange, thank you so much for staying with us on this Don't Wait, Vaccinate Extra. Your questions answered, and helping to answer these questions. We'll put them out there for folks. Thank you to you. Thank you to your colleagues at Fish River Rural Health for being on the front lines of not only the COVID-19 battle, but the effort to get folks vaccinated. We really appreciate it. We appreciate the time that you spent with us today.